Conduct disorder in adolescent with comorbid condition of attention deficit hyperactivity disorder. Case study number 6 by Grace Ojo. Conduct disorder occurs as a mental disorder characterized by changes in the child's behavior. Children with this disease usually manifest with increased level of aggressiveness and lack of adherence to the set rules and regulations. The children with this disease typically show severe violations of the school rules and regulations. They may also remain reluctant to observe societal norms. They might indulge in risky activities that may result in physical injuries or participate in illegal activities that may expose them to arrest by police. Conduct disorder is characterized by antisocial behavior that are chronic and with emotional patterns that are persistent and repetitive, violating the rights of people without remorse or guilt. It is estimated that 16% to 20% of youth have a comorbid condition such as attention deficit hyperactivity disorder, ADHD, with conduct disorder. Conduct disorder in the United States is estimated to be 9.5% with a 12% lifetime occurrence in males and 7.1% in females. This paper addresses the treatment plan for a 12-year-old boy diagnosed with conduct disorder with a comorbid history of ADHD. This boy, as a child, was unusually aggressive, bullying, taking things from other children, cursing, punching, and showing no concern for punishment. Disruptive, impulsive, and fidgety, and diagnosed with ADHD. Although it can be charming to strangers and described as con artist, he is placed in a special education program by 2nd grade, and by 4th grade seeing a psychiatrist. Is non-compliant with medications and weekly psychotherapy. History of present illness. This 12-year-old boy, Kyle, reluctantly agreed to admission to the psychiatry unit. Before his admission, he was caught stealing a cell phone, a jacket, and laptop computer. He was disciplined for mugging a classmate. He was suspended after multiple fights with classmates and arrested twice for behaviors. Constantly losing possession, arrested after breaking into a grocery store. He is consistently unremorseful, externalizing blame, disorganized, inattentive, and does not pay attention to instructions. He does not have a medical problem except for the ADHD, and he is on quetiapine and dexamethasone, although he is non-compliant. The early history of Kyle was normal. No history of sexual or physical abuse, no alcohol or abuse of substance, no participation in gang activities. He was never caught with weapons. He has not set fires, not cruel to animals or children. He had been a regular truant from school but did not run away or stayed away from home until midnight. His biological father is in prison for drug possession. Both biological grandfathers have a history of alcohol dependence. His stepfather is unemployed and lives with his mother. Mother works part-time in a grocery store as a cashier. During physical examination, he appeared well-groomed. He's a young boy and appeared his stated age of 12. His affect is irritable and angry. He was fidgety and made sporadic eye contact. It was reported that he was mad and would go to jail than be in a psychiatric unit. His speech was loud but coherent and of normal rate. There was no obvious cognitive deficits but declined more formal testing. He has a moderate insight with poor judgment during history taking, though. The diagnosis of Kyle. His diagnosis are conduct disorder, child onset, severe type, American Psychiatric Association 2013, according to them. He is also diagnosed as having ADHD. So a group of ongoing and behavioral and emotional problems exhibited by a child or adolescent is known as conduct disorder. The person shows no concern. They show no guilt. They show no understanding or remorse for the pain and damages their behavior has caused others. Conduct disorder is seen more in boys than in girls, according to the American Academy of Child and Adolescent Psychiatry 2019. Hence, Kyle's symptoms meet the criteria for diagnosis of conduct disorder. We should note that major symptoms of conduct disorder are aggression towards people and/or animals, destruction of property, deceitfulness or theft, and serious violation of rules. The diagnostic criteria for conduct disorder. The symptoms of conduct disorders are divided into 4 main groups. And 3 or 4 of these symptoms should have happened in the past 12 months, with at least one present in the last 6 months to meet the diagnosis of conduct disorder. These symptoms are aggression towards people and animals, bullying, threatening, intimidating, fighting, cruelty to people and animals, and use of a weapon and theft while confronting a victim, destruction of properties, which involve fire setting or deliberate act of destroying people's property, lying and theft, and serious violation of rules such as running away or truancy before the age of 13, and the breaking of curfew. Some contributing factors to conduct disorders are physical, sexual, emotional abuse, maternal rejection, and early separation from parents without a satisfactory caregiver. Conditions that are associated with conduct disorders are attention deficit hyperactivity disorder, ADHD, depression, bipolar disorder, anxiety, post-traumatic stress disorder, PTSD, and the abuse of a substance. These are according to American Psychiatry Association. So the treatment goals. Guys have about 7 of the 15 behaviors in the 4 categories which meet the diagnosis for conduct disorder. These are bullying, stealing, fighting, truancy, mugging, lying, and breaking in. So a short-term treatment is to reduce or eliminate identifiable behaviors such as physical aggression, bullying, and shoplifting or theft. While the long-term treatment goals will be anger management, increased parental monitoring, compliance with treatment plans, including medication and family support. Management. The management of conduct disorder in ADHD does involve adequate education about the disorder to patients and family, behavior interventions, psychotherapy, pharmacotherapy, psychostimulant support for the family, and addressing any medical condition that present with it. CHI is at risk of for psychiatric disorders such as mood, anxiety, and the abuse of substance use when he becomes a teenager. With his present conduct disorder diagnosis, Kyle can grow into adulthood having an antisocial personality disorder. Therefore, careful observation is needed for his plan of care now to prevent future risks of psychiatric and antisocial personality disorders. References are as follows.